The views and opinions expressed on any program are those of the producers and/or the persons appearing on the program and do not necessarily reflect the views and opinions of FRC Media, Bristol Community College, or the City of Fall River.
Well, hello, the Spindle City Straight Talk. I'm Chip.
And I'm CJ.
And hopefully we'll get this out today. Monday we did a whole show and it was really good. Take our word for it.
I believe you. I believe you. Maybe because I was there. Well, I'll tell you now. This morning I woke up to all kinds of craziness. And I sent you the link, by the way, Chip, a few moments ago. The Boston Globe did an article on Fall River and New Bedford, and it's a pretty long article, actually. And it says why coronavirus has seemingly spared Fall River and New Bedford so far. And it says here that in New Bedford, whose population is 95,000, the epidemic is responsible for 10 deaths, a relatively low number for the city its size. And Fall River, slightly smaller at 89,000, has recorded 3 deaths so far. All of them family members who work together at a local grocery store. According to the Boston Globe, there are 165 confirmed cases per 100,000 in New Bedford and 167 cases per 100,000 in Fall River, 1/3 the statewide rate. But one of the things that it says very clearly in this article is that we can't be looking at this like there's something different in Fall River, which there is. But they said we have to look at what's going to happen with the surge. We're not Boston, we're not Worcester, but Newton has a very high rate. And they believe that it's because Fall River is a small urban type community that because we're surrounded by farmlands and Mayor Mitchell said that because we're kind of confined, we don't really get out to Boston or these larger areas that often. And as such, we're able to protect ourselves a little better. Both Mayor Coogan and Mayor Mitchell said that because they both initiated lockdown procedures earlier, and I'm paraphrasing here, so I don't want to get a phone call saying that I'm misquoting, because I'm not quoting them, that because they started the social distancing and the isolation and whatnot earlier, they believe that that's been one of the contributing factors. But one of the interesting statements that Paul made at the end of the article, which really opened my eyes a little bit, if I can get that back. Oh, for some reason my article disappeared. There we are. What is going on? Here we are. He says it seems that while we're doing well, it's only with luck, and we're going to wait for the drop to fall out. This is from Mayor Coogan. We're going to wait for the bottom to fall out. So it's been a lot of luck that this has happened this way. I think it has been a lot of luck, but again, I don't want us to take this for granted. It's very interesting to see how this is working out, and the new reports that come out from the state are 23 and 30 pages long, and it's got more information than you need, and they're adding more tracking data that you might want to view and follow. But people just want the counts. But now we're adding in the counts for nursing homes. How many nursing homes are infected? How many people died? How many in the nursing homes? Which people want to know as well, I guess. But
some people do.
Yeah, some people do. And while I'm speaking on nursing homes, I'm going to transition a little bit. Yesterday, the National Guard was at the Kimwell Nursing and Rehab Center on New Boston Road. The National Guard was there to test the entire building. They were testing the building for COVID-19. So far, they haven't said there's any, but we'll see with this testing. One of the other issues that came up in the Boston Globe article is that our testing isn't as robust as say other areas of the state, and the state wants to follow that a little further to find out what's going on. The mayor, Paul Coogan, mentioned that South Coast had 500 and some odd positive COVID cases, but most of those are from New Bedford. We have one testing center in Fall River from Primacare. I don't know if it's still active. I'm not sure if South Coast has one here in Fall River or if it's in North Dartmouth. But I don't see a lot of active testing going on in Fall River. And that could be why our numbers are lower. That's a good indicator that our numbers may be lower. But again, this is Fall River. What are we supposed to do?
Well, I have another theory too. I'll throw this in the mix. That Fall River doesn't have a lot of people coming in and out of it that don't live in Fall River, like Boston does, and like some of these other areas do. Fall River and New Bedford, places most people don't want to come, especially Fall River. I mean, New Bedford may have some tourism because of the whaling museums and stuff under certain circumstances, but with the COVID virus, they're not going to. You don't have a lot of tourism going on. So I think that because we don't have a lot, remember, there are a lot of people that go through Boston, in Boston, and even with this supposed lockdown, there are people that are considered essential. There are people that are going to work, even though some of the workforces have been cut down. There are people going in and out from Newton, from Wellesley, from wherever. And so they go back to their communities and they spread it there. And obviously, we don't have as much testing either. And frankly, I'm getting tired of too many numbers. They're numbering us to death. And the reality is that these numbers are really not going to be confirmed for God knows how long, if they are ever confirmed. We've had a lot of changes in numbers, inaccurate numbers. But of course, being in Fall River, we're used to that because we have to listen to Mary Sahadi all the time.
I knew that was coming.
Yeah, we're not used to having any accurate numbers anyway. And so, people are frankly, I know people that are telling me that they're watching Little House on the Prairie now. Reruns of Little House on the Prairie because they're so sick of being inundated with all kinds of this. Okay, we all know what the symptoms are. We all know that the way to not get this is try to keep your distance, wash your hands. Everybody knows this. And now this constant 24-hour barrage, every time you turn around, Baker's having a press conference, Gina's having a press conference, the president's having a press conference, Pelosi's drinking antibacterial soap or something, and people are just tired of it. They're frankly sick of it. Most of the people I talk to. I mean, look, after a while, everybody's interested initially, but now this has been going on for well over a month, and people have just. I'm tired of it because you can't keep track of the numbers because they change every day. And the reality is that regardless of what happens to the numbers, it's your personal behavior that's going to control whether you get it or not. If you don't expose yourself, the less you expose yourself, the greater your chances of not getting it are. It's not rocket science. If you run around licking counters and touching everything and not washing your hands, okay. If you minimize your trips to the stores and do what they say, which is fundamentally shelter in place, you're reducing your chances. So that's why nursing homes, obviously, as you know, are the real epicenters of this thing because these people are all in the nursing home, and most of them have underlying health issues, and they're elderly, and they got no way to get out of the nursing home. But if you're in your own home, it is what it is. So it's crazy.
Yeah, I understand that. It's interesting because a few moments ago, Mayor Paul Coogan posted on Facebook, Boston Globe story on the confirmed cases in Fall River. We all need to keep working hard to win this battle. we still can't relax because we don't know where the final numbers will end up. Social distance, wash hands, wear masks, and be smart. So
Well, that's what we just said.
yeah, exactly. And I did you watch the Today program this morning? I did, and they had a small bit which they're now promoting, which is kids news. They're going to be airing that on NBC's new streaming service called Peacock. But the parent of that child, which was an actual is Carson Daly, who is well known to people in the entertainment industry. He's on the Today program. He works with The Voice and some other programs. It was his son, and he said he doesn't have the news on in his home. He keeps it off because it's too much information to barrage his children with, and to be honest, it's too much for even him to take anymore. This is reminiscent, although not as bad as the 9/11 situation. When 9/11 occurred, we were barraged with this information. We were constantly barraged. There wasn't a time you could turn on the TV and watch anything else but what was left of the towers. And that's what's happening now. All we've got is, no matter which station you're on, all you've got is the same commercials about the virus, the same commercial about what to do, the same commercial about what not to do. And there are no new programs because they can't tape them. So we have to watch reruns. And there's no new network things. So we're watching things like Laverne and Shirley and, Little House on the Prairie.
That's right.
Or ER or House. I'm thinking of some of the programs I see as I'm flipping through my guide. And I'll tell you, it's, the numbers are going to be so skewed when Nielsen looks at these.
And as you said, CJ, it's way, I think it's, the 24-hour news cycle. We have channels that are dedicated specifically to 24-hour news. We just get too much information. And a lot of this information, it is relevant to the healthcare professionals and to the strategies that they're going to try to take and the tactics they're going to employ to try to get this under control. And realistically, to me, the information we need is how they apply it. Unless, as they did, wash your hands, social distancing. But all these statistics, this upon that, well, it's people, I think, they're driving people crazy, because if you try to listen to this, it's just repetition, and it's too much. And realistically, we have no ability to do anything. If we follow the instructions, as what is Gina's thing, they put it on a T-shirt now. I forgot what she said. Don't do it or something. In other words, don't go out.
Right.
Look, we've got states that are letting people go back to the beaches, and they're beginning to open up, and they're talking about resurgence, and it drives you crazy. And
sorry, we got some information from our host that there was no Gina T-shirt. So whatever the case may be, but interesting that you should bring that up, because when Florida started opening up its beaches, right afterwards they had a huge surge on COVID cases, and there was like 1,400 of them in one 24-hour period. So people were like, "What's going on? Hey, wait a minute!" But the beaches are still open. So I don't get it. You can't lay out and sunbathe. You can't collect and congregate. You can't do this. You can't do that. But you can go swimming. I'm not exactly sure. And just to now transition again a little bit, I just received a message from a viewer, and this was posted by a Walmart employee, Walmart Fall River. Walmart has another confirmed case with an employee. They are doing nothing for our store in Fall River in regards to safety of us associates. Mandatory wearings of the mask was set to start as of yesterday. And still, between both yesterday and today, there are employees who are still not wearing masks. They are not enforcing the policy. This is BS. Refuse to work in a place where this is not being taken seriously. Workers who I come in contact with in bakery who are not wearing them. Action needs to be taken. Precautions need to be met with at all times, not just because of the fact that I am a pregnant employee, but all of these associates are putting each other at risk. GD. Update: our store manager made it known for the first initial confirmed case had no contact with anyone in the store, which I find very hard to believe. And now look, days later, another confirmed case to be told again that this employee had no contact either. Yeah, right. This store needs to be shut down for the proper sanitizing and sterilization procedures. But clearly, all that matters is the almighty dollar. Now, this is an employee who's posting this. I mean, I could put her name out there, but I don't think it's necessary. But we have it confirmed.
Well, I mean, that is a serious situation if management isn't. And thank you, Steve, for reminding me that the T-shirt read "Knock it off." So let's tell Walmart, knock it off.
Exactly, knock it off. Well, the interesting thing is, she's concerned about herself, and I can understand that she's concerned about herself because she's pregnant. But she brought it up. They're putting other people at risk, other employees, but they're also putting the public at risk. The public use the store to get groceries, and because they get groceries, and Massachusetts doesn't have the restriction that some other states do, where you can't shop for clothing and other non-necessary items, but you can go to the store to shop for groceries. Customers can be infected, and if customers aren't wearing masks, they also can be sharing something. Knock on wood, so far, I have not experienced COVID that I know of. Nobody in my household has, and I think that's important. I don't believe anyone in your household has experienced COVID either, Chip. And it's interesting to see how we do this. But
I think that there's going to be some kind of protocol with this. If you get a store such as this, and I think you just said that the person said that there was somebody in the bakery department not wearing a mask. So if you have an infection, I think all employees should be tested for the virus and then required to wear masks, and they should be screened, because now what happens if there's someone in the bakery without a mask that's dealing with fake goods and dealing with stuff that people buy? And so there's a whole bunch of a litany of things and again, it gets down to, these employers should be mandated and have a protocol to, if you have an employee that is infected, they have to make sure the store is properly disinfected, that the employees should be sent to testing, or they should get testing. These are the kind of things that have to be worked out. But it's ad nauseum now. I mean, this is a problem, and unfortunately, it really usurps everything else on the news. And we've been talking about it most of the show again, and we always do because we have to, because that's this is an important factor. But we've got to get back to the city, because we closed the last show that didn't air talking about some things about our great financial team and their lack of numbers at the city council meeting. And I know that there's been attempted defenses of this, even though it's gone on for 30 years. But I have to say that, again, I think that we have been proven to be correct with our representation, that they're not doing their job, that there's no accountability, because the fireboat that was purchased or supposedly purchased or is being purchased.
No, it's been purchased in 2018.
Yeah, well, that's the problem. It was, and we were told, and we said on the last show, that the man was on the radio saying that he didn't have any idea until it broke until it broke at the council meeting or just before it. And there's no paperwork they can find on it, kind of like the 22 windows. So my question is, when is the city council going to get off their butts? I almost said it, and require somebody to ask the question of Mary Sahadi. If she's the CFO, why didn't she know in 18? We're going to make a $500,000 purchase now nobody knew about it till 2020. She's the CFO of the city. She is a fiduciary. She is supposed to oversee the expenditures. And we had a $500,000 expenditure. Was there bids? Was there an IF? Was there an RFP? Were there bids? The thing had to be. They had to have a process here where they had to pick how they wanted the boat outfitted, what they wanted on the boat. So they had to draw up specs. Where are the specs? When were the specs drawn up? Who were the specs given to? Where were the costs that were associated with providing us with the boat? 2 years. Nobody knew about this. Like the 22 windows. You're telling me, and I don't care what Paul says. You're going to tell me, even though I got 30 years of her not ever figuring out how much, they don't care how much we spend. She doesn't care. All she cares is how much money we get in. You're going to tell me that her and Kathy Ann Severus were not supposed to know that we were going to spend $500,000 and nobody in the city council is going to question that. And the city council is going to continue to let her show up and say, I don't have the numbers. Well, I didn't know about it until yesterday. Well, why not? You got a pay raise, you get an automatic cost of living raise, you've been making mistakes since at least 1991. And there's no accountability. And you're going to tell me that that's okay? It's not okay. It's not okay. We had the 22 window fiasco, and just like the fiasco we had in '91, when they took $2 million of our money and put it in their account and didn't know it until an outside firm came in and audited it. And now the 22 windows, nobody can still figure out what happened. We did it again. So there you go. The city has been officially designated as being insane. It's an insane city because we keep repeating the same thing and never fix it.
You break out the Klonopin.
CFO of this city to know where the hell our money's going.
Well, the interesting thing is, I'm looking back on this a little bit, and this was under the Jazel Carrera administration when Jazel and the fire department were like this. They were hand in hand. Anything the fire department wanted, they got. They wanted extra money. They got $40 an hour pay raises for certain departments. They merged EMS and fire, but they didn't merge them. They gave them group 4 status. They did all this stuff that the chief wanted, the fire union wanted. It was catering to the fire department. I don't know why. I don't know what they had on them or what the reason was behind that. Not that I'm trying to deny the fire department what it needs, but they got all brand new equipment all at once, which I think was a big mistake. And maybe that's why they got the new fireboat, because it was all in that same time period. But they were looking at the fact that they had a grant, some federal money, but still it needed to go through a process, and that process wasn't followed. Nor did they let us know that our portion that we had to match with, nobody knew what that was until this past week. And then the money to pay for that was taken out of this year's budget from line items. I can't see doing that. I just can't see doing that.
It's illegal.
Yeah.
Yeah, because that's a 2018 expenditure. So the bills come and due now. So then, just like what he said during our arbitration, they backdated checks, which is illegal. So we do a lot of illegal things. But look, I said on the show that didn't air, look, I can't blame the fire chief for going looking for a boat. So it's his job. So he's looking for a boat. He got up there and said, I was going to look for money from businesses. Well, why don't we wait till those businesses are actually created? Now, my only complaint about that was that if you're talking about getting a $500,000 boat to protect the waterfront that doesn't exist, based on the idea that someday it will exist, why don't we wait till we actually get some businesses down there and enter those businesses that, hey, you got to kick in a little extra because we're going to get a boat to protect your property, and you can solicit some money. And that's a good idea. But it's not a good idea to solicit money from businesses that don't exist.
Right.
Nothing And
No.
he goes out and he gives them the specs.
Right.
Up the
Right.
city to do the right thing. Why wasn't it presented to the council in 2018? Why wasn't this fire vote ever discussed? Why didn't the financial team say the fire department has requested this expenditure and these are the specs and we're gonna look at it, we're gonna go out for bid, and this is the process. No process, just like the 22 windows. Did we ever find out what happened with the 22 windows? No. We had the mayor of the city of Fall River sitting in his office watching the windows get replaced, and he didn't know we were getting windows replaced.
No,
That
it's
was their excuse, and the city council allowed it.
right.
Nothing was ever solved. Nothing was ever resolved. And just like 91 and 08 and 16 and today and 18 and 19 and 20, there's one common denominator: the financial team of this city. The financial team of this city does not know where the hell any of the money is. They never have a real answer.
True, and they prove it. They prove it at every city council meeting. They prove it at every city council meeting.
Never ever says enough is enough. This is the taxpayer money. Why doesn't somebody say you don't have the numbers? Go back to your office, put the packet together. This motion, this meeting is now adjourned because we're tabling this discussion until you can come down here with the numbers we need.
And I think it's important that she have those numbers because the people want to know. Now, from what I understand, the city council meets with the mayor before each city council meeting, and they go over what's on the agenda. So it's going to be interesting. But I just noticed we're running out of time real fast. So I want to thank people for watching. Just one last quick announcement. Boston Market Chicken has closed in Fall River permanently. It's gone over now several times. Initially, it was looking for just for the COVID virus. Now it's permanently. So we've lost another business here in Fall River. Thanks for watching. Stay safe. Stay angry. Take care of yourself. And keep that social distance going.
Because I don't think the mayor should be meeting before the city council meeting. The city council has its job. He proposes, they dispose.
I agree.
That is not good.
I agree.
Let the city council do its job. This isn't a team effort. This is executive and legislative, different branches, and it's supposed to have checks and balances. And that's one of the reasons we got the crap going on that we got going on.
Yeah. Well, thanks everybody, and we'll catch you on Friday. Have a great day.